And here's our special guest coming now. I don't know if you can hear me yet. You're on mute, by the way.
Better?
There you are.
Right.
Welcome, Dr. Paul Lamoreau.
How many minutes do I have to just wait for people to stop applauding?
We'll give it another 30 minutes.
I like it.
All right. Well, thanks so much. I want to introduce Dr. Paul Lamoreau. Before I do that, I'm going to let him do all the resume building with you. Real quickly, I want to share something that we are doing as an organization for dental students and dental professionals. This is our opportunity to take advantage of some free CEs. So we are offering free dental CEs beginning now. And if you are interested in learning more and being able to access an entire library of free dental CEs, just go to aspendentalce.com/welcome. And I'm sure we'll have a conversation with Dr. Lamoreau about some of the CEs and things of that sort. So please feel free to start dropping the questions. Without further ado, I want to introduce Dr. Lamoreau. Welcome. And so just to give you an idea, Dr. Lamoreau, we've been receiving some questions prior to this AMA. So I've kind of collected a handful of them, and I'm just going to start asking some. And also in the meantime, there's some individuals that are putting them in as we go. But let's go ahead and we'll get started. Tell us a little bit about yourself, and then also kind of some of your experiences in dental school and what you've done and where you are now.
Sure. Yeah. So I graduated from OHSU like a year ago, so I'm pretty new as far as things go. But when you work for Aspen, it's like dog years. So even though I'm only 1 year out, I really have 7 years of experience. So just keep that in mind. When I was in school, I was really active in student government. I was our class president. I was really active in ASDA. I served as a District 10 trustee. I was really active in the ODA. Pretty much if there was a thing that could get me out of class and get me possibly free food, I did that. So I built quite the CV.
Nice. Well, tell me about your most memorable experience at OHSU.
Oh, geez.
Right off the bat.
No, I think a lot of times just in the clinic, I have a lot of memorable experiences that really centered around like lab work and honestly like around dentures and crown and bridge and things where, you know, I'd do something, I'd spend like a weekend on it or all day on it, and I'd bring it in, and then like they'd kick it back to me and they'd be like, oh, this margin trimming is horrible and you're never going to be a real dentist and all this stuff. And it was really frustrating to try to get through that. And I've never done any of that stuff since school. And I like that a lot. Like I have my own lab technician and he does all that stuff for me because he's actually really good at it.
You know, that's something. Why don't you elaborate a little bit more on, you know, the idea of having a lab technician and kind of the differences between, you know, what a private practice would do and what you have there in the office?
Yeah, for sure. So I mentioned dentures a little bit, and our lab technician, primarily that's where we use them is in denture therapy. If you think back, like how we do things, you know, in the clinic up on 8 and 9, you're having that patient in and you're taking some impressions, and then you're scheduling them back, and you're going to do like a wax bite, and then you're going to schedule them back, and you're going to do like a wax try, and then you're going to schedule them back, and maybe you had to make custom trays and all these different things where you're sending it out, and all that time you're really reliant on your ability to write down what you want on a lab script and the ability of some other lab technician who you've never met in person to read your mind on what you wanted on that. Like when you have a wax try and you're like, oh, I want you to flare number 7 distally by 2 millimeters, and I want you to change the festooning or whatever you're writing down, and then it comes back. A lot of times you're like, oh, that's not what I wanted at all. If there is something aesthetics a little bit, thinking about moving this tooth. So we're having that communication, the patient's involved, the lab technician is involved, I'm involved, and we can get a really slam dunk case because he can come into the room, and that's just not physically possible other places. Also, a lot of those things like, you know, if I need a custom tray or a wax block, that's going to take him just a couple of minutes. I just tell the patient, hey, sit right there. We're going to have this ready for you in 5 minutes, and then we get him moved on to the next step. So we're able to move through dentures very, very efficiently, very, very quickly, and it's, you know, it's really a lot more rewarding for, you know, for me, for Miguel, and for the patient.
Sounds like it's a quick turnaround, which is great. And so just to clarify, I am on the business support side, and so I will be every now and then kind of just adding my own 2 cents or some factual information about the business support side. We have lab technicians in all of our offices, so definitely be a part of the best interests of the patient experience, which is great. All right, so I got a couple questions that are coming in. This one is about your experience in the office. How many people work inside your office, and how many people are in the average office? And I'd be happy to help with that too. But how many people are in your office?
So my office, we're a 1 doctor office, so I'm the only doctor that's here. I have 3 assistants that work with me every day. And then I have an office manager and what we call a PSR, a patient services representative, who, you know, checks people in, runs insurance, you know, answers phone, that type of thing. We currently have an opening for the position of assistant manager, who's a person that, like the office manager, can do consulting with patients, financing, treatment plan coordination, that type of thing. So we're down 1 person in that regard. So we have 1 less person. And then we have a hygienist that works with me, and of course my lab technician. So if you add all those people up, you get a number, and that's how many people are here.
Well, and it sounds like you're also accepting resumes today, right? So
Yep,
anybody that's interested in that position, you know where to find Dr. Lamoreau.
I am so busy, I'm appointing people into the end of August. So if someone wants to come down as an associate, that would be great.
There you go. Offering job opportunities right off the bat, right? So regarding kind of like your situation when you were in dental school, because we do have a handful of dental students that are listening in right now. How did you become interested in Aspen, and when did you know that you wanted to join?
Well, really, the recruiters are just so good looking that, you know, it's an easy choice. So originally, when I went into dental school, my wife's dad is a dentist. So the plan was always like, I was just going to go work with him. And that, you know, was my plan until about the end of my 3rd year. I went and I shadowed him, and we like got talking about it and realized that he's not ready to retire, and there's not enough patients there to have 2 doctors. So I sort of freaked out and didn't know what I was going to do. Luckily, right around that time, I was a trustee, and I got invited to attend this session called Vibe that I don't think we're doing currently, but it was a session where it was basically an intro session for Aspen, where they brought us out to Atlanta, which was really cool. We stayed like almost inside the Braves stadium. It was great. It was a lot of fun, but they, you know, kind of talked about the company and how it works. And I'd never really heard anything, you know, at school about, you know, about Aspen and what the practice model was like. I didn't really know anyone that worked at an Aspen. And I had, you know, kind of my own preconceived notions that turned out to not be very true. One of the things that they had said at that is like, we have built a company on saying yes to the patient. And that's something that I really, you know, I really believe in. I like the idea of a patient comes in, you know, they might not have an appointment. They're like, oh, I'm in a lot of pain. This hurts. Can you see me? You know, most private practices are going to be like, no, we're going to have to make an appointment. We're just going to be like, yeah, we're going to see you right now. And they're like, oh, geez, you know, I want to get this tooth out today. Can you do that? Most of the time in private practice, you're not set up to do that. It's like, yeah, our motto is sort of, we can do it today. We'll do it today. And I really enjoy that. My favorite, you know, rotation at school was urgent care, because it was always like sort of like a Christmas present. It's like, oh, what's my patient going to be? What do I get to do? And that's like every day here. So it just, the model really spoke to me. The idea of doing like a lot of surgery, I was very interested in. So I started looking at Aspen, although at the same time, I looked at, you know, all the other corporates. I I applied to a prison, I applied to public health, private practice, all sorts of stuff. And when I started getting, job offers back and whatnot, Aspen's contract was like 3 pages that I could understand without a lawyer. That was awesome. There was no, clauses about if I left, I couldn't work, within 5 miles of an Aspen or anything like that. There's no time constraint on it. And it was also, I was like, hey, I really want to live in Southern Oregon. And they're like, well, do you want to live in Grants Pass? And I was like, yes, I'm from Grants Pass. So just really everything just lined up. It was like the stars all aligned. Derek and I got together and had a beer, and here I am.
And here you are. You mentioned a part of it. What was the interview process like?
The interview process was really, really low key, because I think I met a lot of people that were kind of interviewers at Vibe. So I sort of interviewed before I interviewed. Like, I talked to some people and were interested, and then when I was like, I think I want to do this. Were you the recruiter at that time? I can't remember. Yeah, so I told Derek. Derek set me up with an interview with Jim. After I interviewed with Jim, I kind of asked some questions like, do you have like a doctor that I could talk to that's kind of down in the area? And there's a doctor named Dr. McKee. So I talked to him, and then I talked to the regional manager at that time. And it wasn't super formal. It was really like me asking a lot of questions about how things work and, like what I should focus on to, really excel at, at the kind of the Aspen Dental way. And yeah, it was low-key. It was good.
So, and I think a lot of, we do have some dental students on. They appreciate these types of questions and understanding of what exactly happens. And just to clarify, Jim is Jim Medina. He works as a colleague of one of ours, and he has a very close connection with a lot of the doctors. So, obviously when Paul or Dr. Lamoreau mentions connecting with us, he considers all of us friends, and I think that that's a really great experience that you can share with them. Got a question that came in. How early did you start applying to places or thinking about wanting to join?
So end of 3rd year, when I had that freak out and I had no idea where I was going to go, I just went down. Like, I had been like the fundraising chair for ASDA, so I knew like I had a lot of contacts. So it was like everyone that was involved in hiring dentists for anything I sent an email to. So I started, right around end of 3rd year, beginning of 4th year. I found what I was looking for, which was Aspen. It came together very quickly, and I think, I signed and I was ready to go by, end of 1st term, 4th year, something like that.
Wow. Yeah, and so just to clarify, you decided to commit prior to even graduating. Is that my understanding?
Oh yeah, and it's with the way that the contract is and whatnot, where it's sort of it's open ended and things like that. It was like really easy. It's like, okay, this has everything I want, but I'm not, if something came along that was different, or I wanted to explore another option, it didn't hurt me at all to be like, yeah, I'm in. And that's something that like throughout the whole process, I always felt like, I remember I asked the question, like at some point I was like, well, what if, it didn't work out and I wanted to leave and like work at my father-in-law's practice, which is like less than a mile away? And they'd be like, yeah, that'd be fine. And I was like, oh, okay. Well, it's kind of like that whole Cartman land thing. They're like, no, if you don't want to work here, we don't want you here. And I was like, well, now I want to work here even more.
Exactly. And you've brought it up a couple times, so I think it'd be a good time to mention it. There is a question that came in prior regarding that, and you've mentioned it multiple times, and maybe we can clarify stuff. What does the contract look like?
So it's really cool. It basically like has your name and Aspen, and it's like you're going to go into this office or this collection of offices. Some doctors, will work at multiple offices and things. It gives you your daily rate, and that's more or less the brass tacks of it. The rest of the contract, kind of specifies, who they use for malpractice and benefits and, that type of thing. And the last page of the contract is kind of awesome. It's basically a policy that's saying if anyone tries to change your treatment or do treatment plan for you, you need to let us know so we can fire them. And that meant a lot to me as well, because it's like, you know, I want to feel good about the treatment I do. And, you know, all the treatment that I do, I diagnose. You know, if something comes in that another doctor diagnosed, which is kind of rare because they'd be coming from another office, you know, if I don't feel confident in that treatment, I just have a discussion with the patient, and then we, you know, they either go to that dentist to get that treatment done, or, you know, we do something that I want to do. It's a weird way to put it, but
yeah,
something
and
that I
yeah, and to piggyback on that, I know that you have legally, yes, it is considered from a law standpoint called a contract, but we look at it more as a letter of agreement, which is essentially saying this is an agreement between us as the management side and you as the doctor in order to go into business. But just to clarify, there are no terms of agreement. Is that correct? And then also, can you elaborate a little bit kind of on the idea of a daily guarantee?
Yeah, so the daily guarantee is really interesting because when I was first looking at it, that was the big thing that was really super important to me. It's like, oh, I want to have this really high daily guarantee or whatever. But really, like Aspen's model is more of a profit sharing model. So the daily guarantee is really, really nice. It's very nice to know that you always have a minimum that you're going to make every day. But the really cool thing about Aspen is your other payment, your bonus potential, is off of your office profitability. So that means if my hygienist is killing it, I'm making a bonus. If patients are buying, toothbrushes or fluoride gel or things that literally are zero chair time for me, like I'm getting more in bonus. And it's really nice because it really rewards you for having an office that runs well. It makes you want to make sure that all your team members are effective in their job, because it all, kind of comes back to you in that regard. And then the daily guarantee is very simple. If you're there that day, you're guaranteed that you get that amount of money.
That's a nice way of saying it. And then obviously we can go down an entire rabbit hole regarding the descriptions. If you're interested in more information on that, feel free to reach out directly to me and I'll have our contact information. Let's transition over to back to when you graduated and kind of transitioning into the beginning of your work career. We have a question that said, how have your clinical abilities changed since graduation?
Oh, geez, it's a lot. If you think about like the number of things we do in school, it's so minor. Like I think I did like 11 crowns in school, and I've done like probably more than 11 crowns this week. Like it's just, you get so much repetition. But one of the things coming in here that I knew I was going to be the only doc, and I knew that from OHSU, my surgical experience was limited, and we had kind of that like, oh, if the extraction goes surgical, you got to like ask the resident, and they're going to be like, oh, the buccal bone is sacred, and then they're going to yell at you, and then they're going to come over and take it out with a handpiece for you, and you kind of watch. And so I had done like I think 3 or 4 surgical extractions, but I'd never touched a handpiece, and I knew that was going to be something that I would need to do. So I told my regional manager, I was like, hey, I know I'm coming in doing this. Like, I like surgery. I'm excited by it. I know I'm not there yet. How do we do that? And she's like, no problem. We're going to do your onboarding. We're going to send you up with an owner doctor that's just like a wizard at surgery, and you'll basically have a mini surgical residency. So I went up and I spent about 6 weeks in Washington, Idaho with a doctor named Dr. Lowsky, who is amazing. He's like one of the super GPs that, he does implants and all-on-4s and sinus augmentation. He does it all. And he just really broke down a lot of concepts, not only in surgery, but in, restorative and crown and bridge and everything. Gave me PowerPoints, gave me all the resources that I could ever want. And he's been available to me as a mentor ever since my onboarding period. And, just through having that additional extra instruction and knowing that I have the support, like I definitely still, if I see an x-ray and I'm not 100% sure, I'll snap a picture and send it through our group chat to like, hey, should I do this or should I refer, or how should I approach this? And people are really good at responding back very quickly to those things. And just through, challenging myself, taking on cases, I think I've done something like 3,500 extractions since I've been here in the last, year minus the 2 months I worked as a teledentist. I've gotten very confident in that, very good at that. You're just like, the more you do and the more you can find those cases that are just right on the cusp of your ability level, where you're like, okay, I haven't done one like this, but I've done, 6 that were very close to this. Now I'm going to push myself and do this one. You just grow, and it's a great environment. We have, specialists that we can talk to in every specialty. It's just a fantastic place. We've just gotten really, really big on Microsoft Teams now, and we have this whole implant forum. So we get to bug doctors in there and kind of learn about implants and different things. And it's just like, the resources are there, the support structure is there, and just the more you do, the better you get.
Great. And we'll probably touch on that a little bit. I got 2 questions that came in that are very closely to tips. So we'll start with the first one. This one came in yesterday.
Yeah, you can send directly to my PayPal.
8%, right? 8% or higher, right?
Yeah, at least.
All right. This one, I'm just going to read it out verbatim. How much did you save to get over the gap between graduation and your first paycheck? And it says, I've heard around 20,000. That's kind of the rumor. Is it still beneficial if I'm having to take out excess loans, or is it inevitable to get through those few months?
Wow, I am probably not the best person to ask this. So the best advice that I can ever give anyone is just 2 words, and that is marry rich. So my wife works in banking. I'm going to brag about my wife really quick. So earlier this week, she is a bigwig in SBA Lending Small Business Association, and she's worked almost nonstop since COVID because of the PPP lending program. So she did so many loans and so much policy with PPP that she actually advised Congress on Monday morning on the direction of PPP loans going forward, should we need to, explore that in a second wave of COVID. So she's very good at what she does. She's also pretty well paid. So we were taking out maximum in student loans and actually putting that money towards buying a practice originally. So we had a pretty good sized egg when I graduated. And so we were like, well, we're not going to buy a practice, let's buy a house. So we just bought a house, and, we didn't have that kind of thing. If you guys don't know, like, I'm almost 40, so I'm a little bit different than, the typical, like, straight out of high school to college to graduate school kind of person.
So I think the one thing
that
we can carry away from today, right, is marry rich.
Marry rich.
Obviously, if that was a great question, because it is very listed on a strategy. And if Dr. Lamoreau has a different experience, we'd be happy to share other experiences with you. Just reach out to me, and we can also cover that idea and that topic as well. On top of that, this is another tips to get a jump on receiving your license after school.
Whenever you can check out a clinic. Like, you should work as hard as you can to get out as early as possible, because when I put through my information, there was only like 3 or 4 other people from our school that were doing that. So mine got processed very quickly versus the people in my class that graduated at, like, not the early checkout. All of those, 72 or whatever applications are trying to go through at the same time. And there's one lady in the office up there that does that. So it just gets backed up and it takes longer. So as early as you can do it, the day you check out, you should be submitting your licensure paperwork. The other thing is, you want to, as soon, be on top of your emails. As soon as you get an email where you can go get your fingerprints, or you can go register for DEA or whatever that is, you want to be able to do that. I think my DEA license was like the last thing to come through. So there was a small amount of time where I couldn't quite get into my office yet because we needed my credentials to go through. And my wife made me shovel a bunch of gravel at home. That's if I'm at home, she makes me shovel things. But worth it.
That's great to know. We're getting a real in-depth learning of your life as well, and it's great.
True, it's
Uh,
great.
so one of the big topics that's going on right now, and we're getting a lot of questions on, is regarding PPE. How is your office operating from the safety side, and provide some examples of how it's been helping the patients and how you're taking care of the patients?
Yeah, so the biggest thing that we do is we limit the amount of people that are in the building. And I'm breaking a rule right now. Everyone that's in the building is supposed to be wearing a mask. So I'm in my office with the door closed, but we are all masked up at all times in the office, other than when we're talking to the OHSU students. But when a patient comes in, we're going to give them a mask if they don't already have one. And then we're also going to ask that they don't use the waiting room. So that means we're calling them in from the car. We're taking them with a mask on straight to the dental chair. We're not allowing, other people in the dental operatory unless it's a special situation where a person needs a caregiver, power of attorney. There's some different things that we can go in there. And then we're entering fully PPP'd up. I used to, come in and say hi to the patient, shake their hand and then put on gloves and a face mask and, kind of talk to them from there. We're just minimizing the encounters like that. So I'll come in actually with my mask on, gloved up, talk to the patient, do my examination. And then if we're doing treatment, say we're going to do anything that generates aerosol. So I'm going to do, fillings, crown and bridge, those type of procedures. In addition to my lab coat, my mask, my goggles, my very stylish hairnet here. We're also putting on another disposable gown. We're wearing a face shield. We're wearing an N95 mask with a level 3 mask over the top. And of course, gloves. And then we're doing our procedures in rooms where we have door closed. We're using high volume suction. We're minimizing as much aerosol generation as we can, while also keeping as many people that don't need to be, even in the building. So that's really how we're approaching it. Aspen has been really good about every week. I just get a big box of PPE stuff. So I've never been in a position where, I don't have what I need. When we first came back, I mentioned I worked as a teledentist for a couple months because my office was actually closed for about 2 months there. We had to wait for about a week for that shipment of PPE to get in. So just during that time, we did a lot of, kind of working our schedule and doing catch-up stuff where it's like, well, we're not going to do aerosol generating yet because we don't have the masks and things. So we'll do, we had a lot of patients to see to do like adjustments and soft liners and things of that nature. And then, some crown deliveries and things. We did those.
That's great. So, I think I received 2 questions and I'm going to combine them together. How many patients were you seeing pre-COVID, and how many are you currently now based on COVID?
So today is a half day. I worked 7 to noon, and we saw 1, 2, 3, 4, 5, 6, 7, 8, 9.
A half day? You work half days?
Yeah, so we saw 18 patients today.
Wow.
We had a full new patient column. So the way that we kind of do things is we have a productive column, which is where we're doing fillings, extractions, crown and bridge, that type of thing. We have a hygiene column that my hygienist works in. I may or may not go into those rooms, just depending on what she's doing. A new patient column, and then an overflow column. Overflow column is where we're, doing post-ops, deliveries, and then our denture steps, wax tries, bites, impressions, things of that nature. It sounds like a lot, but we're really geared in a way where it works fluid. Again, I have 3 DAs, so some of those overflow procedures I don't actually go into unless I just go in and I say hi. We had a patient today that I brought in some chicken feathers because she asked me to, and that was the only time I was in during that. I have 28 chickens, just as a fun fact.
You have too much fun.
I do. I live on a farm. It's great. We just got a couple goats. So in an average day, I'd say we probably see maybe 30, 35 patients across all our columns. And that was pretty similar to us pre-COVID. We were maybe closer to 40 at that time. It's a different model, the way that we're able to to do things. So I know it sounds like a lot, but I don't feel busy most of the time. Now, of course, there's times where I find myself needing to be in two places at once, but usually that's when that happens, we look back and say, oh, we shouldn't have scheduled it that way. When we run the schedule very well, everyone kind of is in their own place, and we can get a lot accomplished.
Awesome. I mean, it sounds like you're able to manage it all, even though you are one person. But it sounds like sport's good, right?
Yeah. I have fantastic assistants. I couldn't do anything without my assistant.
That's great. All right. I have a couple questions about your experiences when it came to just getting started off. How many patients did you originally see in the beginning? And what was your quota? We'll start there. So how many patients were you seeing in the beginning when you started, and what was your quota when you originally started with the company?
So I'll kind of answer the second first. Like quota, there's never been a quota for anything. Like appointment times, like I get as much time as I feel like I need. When I first started out, I was, getting an hour and a half to 2 hours for filling, 2.5 hours for crown prep, however much time I felt like I needed, because I make my own schedule. So when we're scheduling out patients, it's like, how long am I going to need for that? I just tell my staff, and that's what it's booked for. So I don't have any quotas that I've ever had to reach at any time. When I started out, like I didn't just go into this office and see like 40 patients a day and be awesome like right away. Like everyone knew that that's too big of an expectation. So I did my mini surgical residency, but then I went through another thing that's called the doctor development program, where they partnered me up with a doctor that was in Springfield. Her name's Dr. H, and I went up and the first week I kind of just shadowed her and learned how she does things. And then the next week I took over one of her columns. So I started doing her production. Now we found out in doing that the first day that I was way slower than she was. So then we kind of did the second day, I did every other patient because I wasn't fast enough to get through them. But by the end of that week, I was finding that now that I knew, kind of the flow more, where things were, like what instruments she has, I wasn't looking at the handpiece going, how does this work? That type of thing. I was able to kind of do that production column. So I did that, and I did that the next week. And then the following week, she's like, let's get you started on new patients. Now, all the time there, she's mentoring me. She's teaching me about things. If I'm not in procedure, I'm following her around, kind of learning. So then the next week I took over, new patient column as well. The week after that, I started doing, the stuff that needed to be done in the hygiene column, periodic exams, kind of errand hygiene checks, things like that. And then the last 2 weeks, I took over the overflow column as well. So I kind of slowly, kind of geared up into it. And once they felt that I was ready, that's when they sent me down to my office. Now, I did that in about 6-ish weeks or 5-ish weeks. I can't remember exactly, but if I had needed more time, they would have kept me with her for longer. My check off, there was a number of things. It was very similar to CSA. There's a number of things she had to mark me competent before I could go and do my own office. So it was, I never felt rushed. I never felt pressured into doing anything. I still it's just funny. Like I get the quota question a lot. Like they're like, how many crowns do they force you to make a day? That's not a thing. If a patient needs a crown, I do a crown. If they don't, I do something different. And, that's just the way it works. It's just kind of funny because I know there's a lot of, information that you guys hear in various places that it's just, it's been not my experience that way at all.
So to kind of add on to that, we got a question about the business. How has it been learning the business side of the practice after having some sort of limited knowledge in dental school, and how were you able to catch up on that?
Yeah, so, and it's worse than limited knowledge, what you guys get in dental school. Like, unless you're, in as listening to podcasts and doing a lot of your own research, you really don't get the business side of things, which is unfortunate. I was podcast junkie. Feel free to email me or text me, and I will give you lots of dental podcasts that are really great if you want to learn about business or just whatever. But I had a good idea before I went into dental school. You know, I owned and operated like 3 different businesses. Like, I know what a P&L looks like before dental school. I kind of knew how things worked and what to expect. But even with that, you know, and the knowledge I had from dental school, when I was with that owner doctor, Dr. Molesky, learning about surgery and stuff, he owns, I think, like 6 offices or something like that. The guy's amazing. He's my role model. But I had him go through all of his practice metrics with me. We talked about P&Ls. We talked about controllable expenses. You know, we really looked at, you know, what numbers and metrics you should follow to see if your office is healthy, and also how to troubleshoot. It's like, oh, if this is down, this is what you should, you know, be focusing on. And one of the really nice things about Aspen is we have like 800 and some odd offices, and I can look at everyone's numbers. And I do a lot because I know a lot of people who work in Aspen, so I'll compare days and I'll text people and be like, I'm kicking your butt, stuff like that. But I know from those 800 offices, I can see what an average number of whatever is, or an average amount for one doctor of these different things. And I can kind of see, is like, is my office normal? Am I doing too much of this? Am I doing too little of this? What should these things look like? So we track just a lot of different things. And I have my metrics page open, and that's everything from like, how many new patients do we get a day? What is my acceptance rate? If I see a new patient, like what are the odds they're going to say yes to whatever the treatment we prescribe is, and what percentage of that? And then of course you have your numbers, like your production numbers. How much did my office make, and how was that broken down? How much of that was dentures? How much of that was hygiene? How much of that was you know, the dentistry portion? And then we track things like patient satisfaction reviews. That's a big part of how we bonus as well. The better my patient sat scores are, the better my bonus is. We track online reviews, and, you know, kind of like our if you get it more into number stuff, like what your deposit versus your production was. So how much of the dentistry you actually did we actually collect for? And, you know, what does our accounts receivable look like, and different things. So you can drill down on, you know, all of these. You can look at different offices, you know, and again, if there's stuff you don't understand, there's people within the company that are definitely able to help you do this. As I'm what's called an MCD, a managing clinical director, which means I kind of run the office. I'm in charge of that part of it. And to do that, there's some additional training you get in looking at these metrics and the business side of it. I got sent to Chicago, and I did a program called EDGE. I also went to the Aspen Dental Leadership Summit, which was in Miami. It was very terrible that they sent me to Miami for a week, and I had to learn about some business stuff there. But
where was my invite?
Huh?
Where was my invite?
That's right. They left you at home, huh?
It's great.
Yeah, no, that was a great time. But yeah, when you're ready for this information, you know, they have it there for you, and they also have it systemized. Like, all the information, like, there is very easy to get, and it's like, you know, there's 800 offices. They know the system of kind of rolling this out to you and what it should look like. So there's definitely, if you're asking a question, like, not only have they been asked that question before, they probably have, you know, a book of resources to how to get you to answer that.
Yeah. And just to kind of add a tad onto that, all of these metrics are made to make you become a successful doctor. You know, sometimes individuals will look at that and get a little overwhelmed by it. But at the end of the day, the most important thing is offering these the patients that are coming in the care that they need, right? And that time comes, in order for you to become motivated to learn more about the metric side, especially as a managing clinical director, or also known as a lead doctor, right? You'll have that ability to do it. So we received also another question, kind of more on the associate side. You know, is there a slower start? I know you kind of mentioned this briefly, but is there a slower start for associates in order to get there? And on top of that, how long does it take to become an owner? If you can.
So on the associate side, I mean, you're going in, and if you think about an associate, it's sort of like you're always in the doctor development program, because there's another doctor in that office that is your mentor that you're learning from. Now, most of the time in that, you're going to be an associate, you're going into an office that's owned. Not always, but most of the time. Now, I wanted to have the ability to buy my office. So I was really looking at ownership, and I wanted to own kind of as quickly as possible. And I originally had planned to buy this office by now, but COVID was a wacky thing that kind of threw a monkey wrench in it. So we've kind of pushed that back, and we're looking more at the end of the year for that. It just depends on what the office looks like. They won't let you just come in and buy an office, because you got to prove that you're a good fit for that office, that it can work, and that it wouldn't be. You don't want to be in a position where you go and you buy your office and then you're running into debt because you're losing money on your ownership loan or something like that. They actually have a whole team of people that work with you to make sure that when you buy the office, it's actually going to be profitable for you to buy, and it's going to be something that's shown that you know how to run it, and it can support itself, and make it so that you wouldn't be taking a dip in your paycheck, because no one wants to become an owner to make less money. That doesn't make any sense. So you can get into ownership. I think the quickest anyone has done it, if I recall right, is Meckelberg was like 10 months, something like that.
Dr. Brandon Meckelberg, correct. He is now currently in Florida, North Florida?
Something like that.
Yeah.
He's too talented. Like he can sing, he's good looking, he's a great dentist.
Well, just keep in mind, yes, we do also identify, wink, wink, on special talent. So if you have a special talent, you have that ability, right? It makes you look even better.
Yeah, I showed him like this thing where I could like make it look like my thumb was coming apart. They're like, "Oh, get that man in office."
You're getting there though. You're improving. So I know that you mentioned briefly about buying a practice. I just want to clarify that ownership opportunities are available for Aspen Dental. That may not be the case for every DSO or every large practice, but you do have that opportunity. Yeah. If there are any questions on that, I'd be happy to answer those a little bit later as well. We also got some questions in regards to CEs. So I know I mentioned the whole CE opportunity. What CEs have you done since you've been with the company, and which ones are you looking forward to doing?
So when I started out, I mentioned kind of some of the things I was sent to, like Edge and leadership, whatnot, that had CE built into it, and a lot of it was on, treatment plan presentation. And those have, I think, been the most important ones, because, in school, you're like, treatment planning, that's something that I need to, be able to do after I see the patient, and like they go home and I write down a bunch of stuff and then we bring it back, it's just not realistic. Like when I see a patient, I'm needed to be treatment planning them and thinking forward, and, being also confident in what I'm going to deliver. And so that was sort of where my CE started. I looked at not only stuff just through Aspen, but some different things that, I found online through a variety of places, dental nachos and whatnot, about treatment plan acceptance, presentation, how to treatment plan, that type of stuff. But then I really started focusing on getting better at procedures. And we have, learning and development site that pretty much you can go in and you can put in anything you want to learn more about, and there's CE that you can take. So, that started with composites, how do I make my crown preps less sucky, that type of thing. And then I did a lot of CE on surgical stuff. I wanted to remove third molars, because that's what real dentists do. So I did a bunch of CE on that. During furlough, I took nearly 100 hours of implant CE. So I'm just waiting to get a CPCT, and then I'm going to start doing some implants, which is pretty exciting. We just got our iTero scanner, so my staff and I are currently doing Invisalign training. We should have that done by the 14th of August. So that's some more CE I've done. I've done a lot of CE now that I'm really thinking about it. I did some laser CE because I got a laser, so I was like, I should learn how to use this. So that was good. I still haven't used it yet. I cut a piece of bologna with it the other day, but that's so far all that we've done. We're just waiting for the right time.
I'm sure it was a successful procedure. You mentioned teledentistry. We had a question that said, are you using teledentistry? And did you ever use it before, prior to this?
No, I feel like teledentistry more or less got rapidly developed when, COVID happened, because it was just like, we had the thing in the States that said no emergency dental care until it was like June 16th or something. And, a lot of dentists are like, there are no true dental emergencies. And other people are like, no, you got to keep these people out of the ER to do teeth and whatnot. No one really knew what was going on. And, we weren't sure what patients to appoint. And kind of the company strategically, my office is newer and has less demand than Medford. So they kept Medford open initially, I think. And then they had Klamath Falls open. So they closed some offices, opened some others. And it was okay because they were like, hey, do you want to work as a teledentist? And I was like, I don't know what that is, but sure. So, yeah, I fielded patient phone calls. It was me, Rosalind Mumpower, if you guys know her, she was in my class, and Trisha Patel was the team for Oregon, so all OHSU grads. And we just kind of split up the days, and we get calls that would come in, and we'd video conference with the patient, be like, yeah, that looks pretty gross. Let's get you on some antibiotics. And, sometimes we'd refer them into someone that was open, or an oral surgeon, or an endodontist, or things like that. Other ones were like, let's see, how we can manage this without getting you into an office. And of course, we did have Aspen in the state that we're open that we could direct them to. So, yeah, I'd never done it before. I'd never had training in it before. They put together a program very, very rapidly. I think my office closed on like a Thursday. So I had like Friday, Saturday, Sunday, and then I got a call on Monday like, hey, you want to be a teledentist? You start work tomorrow. So I was like, I had like 2 extra days off, and then I was a teledentist. And since I was at home, I also during that period shoveled about 40 tons of rock. I told you if I'm home, my wife makes me shovel things. So our backyard looks great though.
And we'll make sure to provide your number to everybody else that does have home tip advice as well. So
yeah, definitely.
We'll make sure that that's there. I just want to be very respectful of everybody's time. It's about 12:48 for like another 5-7 minutes, because I know that a lot of us mentioned that they have to leave just a tad early. However, let's get down to the nitty-gritty. What has been your most difficult procedure that you have done since being in the office?
So, there's like things that I've done that were very difficult, but went very smoothly. Like I have done some mandibular tori removal. I've done some impacted third molars, and those are difficult procedures, but when I took those procedures on, I knew what I was doing, and I had done some CE, and I kind of went by the book, even though sometimes it was like, oh, a little scary. Okay, no, it just went fine. But the most difficult procedure I can think of was my first week here. We had someone come in it was 3:30 or 4 o'clock, and they were in a lot of pain, and they needed number 31 extracted. And man, I stayed with them and elevated on it and did all sorts of stuff. And then at 6 o'clock, I sent them to the oral surgeon. That was a bad day. So that was, and that's going to happen to you. You're going to have things like that happen, especially early in your career. And, you got to use those things as a learning experience. You got to recognize what went wrong. I used to be afraid to section teeth is really what went wrong on that one, and tried to use an elevator for an hour and a half. I still feel bad for that guy. But yeah, so that would be the most difficult procedure, but it shouldn't have been. I've done other things. I'm much better now. Now if a tooth takes me more than 5 minutes, my assistants look at me is it hard? But yeah, so it's, you learn. It's a learning one. The first 100 of whatever you do are going to be pretty horrible. So I can break that to you. But then you get better, and when you do 10,000 of something, you're a master. And I'm really keeping track of my extractions, because I'm going to tell people I'm an extraction master when I get to 10,000. So about 6,500 to go.
We'll make sure to send that certificate in the mail. So,
Love it.
this question just came in. What things did you wish you would have known before starting? I guess I'll add on to that. Like, what were the incredibly difficult parts to starting, and elaborated kind of in that particular area?
Yeah, well, it's kind of funny. Like, I used to give this presentation to the first year dental students. It was called 10 Things I Wish They Taught Me Sooner. And it was about like dental school. And I actually put together this presentation during COVID because when I wasn't shoveling, I had to be doing something called 10 Things I Wish I Would Have Learned Sooner. But it's from the perspective of like a new doc, and it's actually based on kind of the learning at OHSU. So, you know, one day you should invite me out there somehow, and I will give you guys that presentation because I'd really like it. But I think the biggest thing that I learned about is, or that I wish I would have made a realization sooner, is there's no anesthetic pill counter that's going to come in and be like, you used a whole carb when you could have used a half carb. You're a bad person. But I feel like I got that impression in dental school. There was always something you'd learn about injections, and it's like, oh, you usually use a quarter carb here and a half carb here and a blah, 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 blah. And you would do that, and you'd do that little injection, and then you'd like feel around or do whatever, and you could tell the patient's not numb, but you felt like you gave them enough anesthetic. And then you start like trying to do stuff, and they're like, oh, no, it hurts. And then you go get someone, and they're like, you should give more anesthetic. And you're like, I'm an idiot. It took me a while to like get out of that mindset. Like, I am not going to elevate on your tooth, drill on your tooth until you are really, truly, profoundly numb. And I see a lot of people that, you know, are in a lot of pain. Like, I do full mouth extractions like every day. I do some endo and some things like that. And, you know, we always think about like, oh, the hot tooth or the tooth that was hard to get numb or whatever. It's like, you got to numb that tooth. You know, there's no extracting a tooth on somebody that is hurting. Like, it's hurting, they need more anesthetic or a different injection technique or a different type of anesthetic. So really, you know, working with, you know, Dr. Lowsky, I learned a lot about just anesthetic technique and, you know, what to use, when to use, how to use, how much to use. And I've kind of built that, like, I get a lot of, you know, it's really weird because, you know, you take out someone's tooth and then they write you a good review on Facebook. Like, he took out my tooth and it was so comfortable. It's like a bizarre thing to hear, but we hear it pretty frequently. And we hear people that, you know, like, oh, I had the worst experience because it was so painful, so I never went back to the dentist again, but now it hurts so much and I'm here. And you're like, yeah, you probably just weren't numb all the way. Like, let me just get you numb all the way. And so that's a big thing. That's something that I wish I would have developed more in school, like just proper anesthetic technique. And then, you know, I mentioned like I didn't feel like we got enough oral surgery experience. I know the director of oral surgery has changed. I think it's different now, but I really didn't know how to section before I started. So knowing when to section, how to section, if you're going to be doing surgery is important. And just, you know, ergonomics and chair positioning, I always thought was kind of silly when we would have that like half hour that they talked about that in school. But I was finding that like even when I was getting out of school, like I was starting to have like neck kinks and like my lower back would hurt sometimes. I was like, man, I got to do something different. And when I worked with Dr. Lowsky, he never sits down for anything. He like stands for everything, does endo standing up. He doesn't wear loops. I swear the guy's a robot. But I was like, do you stand for everything? He's like, yeah, it's great for my back. When I need to move, I just twist. It's great. He's like, you should try it for something. So I did like in Springfield, like my first filling it was like an occlusal on 30 with some super simple thing. I stood up for it and I was like, whoa, this is awesome. And I've never sat down really again. Like I only sit down when I talk to patients about treatment planning. Otherwise, I stand for exams, I stand for extractions, for restoratives, just everything. I love it. So, you know, just little different things like, you know, if you're hurting, you need to figure out how to fix that. You need to fix that now because you don't want to, you know, end up on disability or anything like that, but get disability insurance. And then, you know, anesthetic technique, it does, you know, most people aren't going to be like, oh, that was the greatest injection I ever received. Like most people are going to go, I hate injections. And that's fine. People tell me they like injections. I think they're weird and I send them somewhere else. but just knowing how to get every tooth numb. And then it depends on how you want to practice, like what things to really focus on. Like, do you really want to get good at, you know, composites? Then you should start looking into like BioClear and different things like that. If you want to get really good at crown and bridge, you know, look at like, you know, Bill Stroop stuff. You know, there's a master out there that you can find CE to become better at what you do. Oh, there's this video on YouTube. It's called, I think 10-minute crown prep or 1-minute crown prep or something like that. And I learned a lot about crown preps from it, because they talked about when you're doing your margin and going down on your, you know, your axillary reduction, you think of it like taking the skin off an orange, like you're peeling an orange all the way around, all the way down. And yeah, that made my crown preps a lot cleaner and a lot faster, and patients really appreciate it if they're not in your chair for 3 hours, for sure.
Well, it sounds like we got to get you back inside those classes to start doing presentations on that, because you got a lot of advice that I think we can even accept that over here. Last but not least, I'm going to finish off, first of all, thank you so much, with one final question, because I know you're a movie person or a show person. Top 3 movies or shows that you feel that are must-see right now.
Oh, geez, right now?
Right now.
I'm gonna go with kind of a weird one, but it was like right now, like there's a lot of craziness happening in
Let's
America.
just do the one. Let's just do the one for the sake of time.
Okay, for the sake of time, I'm just gonna throw this one out. It's a crime drama. It's a British show, because I needed like a break from watching American television. It's called Unforgotten. It's about these 2 cop detectives in England that basically they do cold cases. So the first episode, they're gonna like find a body from like 15 years ago, and then it all like pieces together. You know, it gets solved by the last episode. And it's, you know, it's somewhat formulaic, but it's really good, and it's just interesting watching you know, that type of television, which is like a standard thing that we have here. Like we have CSI Miami and all that type of stuff. And just see like a different approach. But it's really well done. It's really interesting. I just watched like 3 seasons over the last like 3 weeks. So that's my recommendation at the moment. There's probably better shows, but that just happens to be the one I'm watching.
I wrote it down, Unforgotten. I'll be looking it up, and everybody look it up too. Okay, thank you so much, Dr. Paul Lamoreau. Everybody's clapping. Unfortunately, I'm going to be closing this webinar prior to everybody clapping, so hopefully you'll be able to hear it from here on out. But thank you so much again. I want to clarify just one final time. Again, I always like to promote this, dentalce.com/welcome. And if anybody has any questions regarding the admission process or questions on that, feel free to contact me, or you can contact Dr. Paul Lamoreau. There's our contact information. Again, thank you. I love you, brother, and we'll talk soon. Have a good one, everybody. Have a great weekend.
All right. Thanks for having me. Appreciate it.
Bye.